Pleasingly, we had over 20,000 tests in the last 24 hours, and I just want to reiterate my message from yesterday, which is we're deeply grateful that people have come forward to get tested, but there is obviously a noticeable dip on weekends, and we really don't want people with symptoms or people feeling unwell waiting until the Monday to get tested. So if you do feel the onset of symptoms or you feel unwell, please make sure you get tested on the weekend. Overnight in New South Wales, we had 5 new cases, 2 of which were in hotel quarantine, 2 of which are from existing known clusters, and the 5th, I want to stress, or the 3rd community transmission could be a false positive, but it's in someone who's in a border community. The 2nd test they had was negative, and so that's still being evaluated. So worst case scenario, we have 3 community transmissions. In all likelihood it's 2, and Dr. Chant will give us an update specifically on those cases. So New South Wales continues to do well, and I do want to ask everybody to continue to be vigilant, to continue to follow the COVID safe rules. What we can now say is we never know what's around the corner, but I think it's fair to say that the strategies we put in place, the policies we put in place have been working, and I don't say that in a complacent way, quite the opposite. I say that knowing that anything can happen around the corner, and especially now as the border is easing between New South Wales and Victoria, that adds an element of risk, and as I said, there could be a case in those border communities which Dr. Chant will talk about. So there's no doubt that easing that border does bring with it risk, as does our intent to consider what opportunities we have to ease pressure on families moving into summer. In that vein, I want to thank the task force that I set up with the Deputy Premier, the Treasurer and Minister Ayres as the Minister for Events, but also Tourism and Jobs, that the health advice now says that major stadia in New South Wales are able to go to 50% capacity rather than 25%. But I do want to stress that there's a number of caveats in that. The 4 square metre rule in principle still applies, and there will be an expectation for people to wear masks when they're going to their seats. Obviously, once they're seated, they no longer need to wear the mask, but in getting to the venue and getting out of the venue, there is an expectation that everybody will be wearing a mask, and Dr. Chant will continue to work with those stadia, those venues, to make sure that happens. In many ways, a large venue, so long as it has tickets and seats and zones and very specific caveats, is able to be a managed and controlled event, and especially given it's outdoors, it also reduces the further risk. And please rest assured that out of everybody around the table, I'm probably the least likely to support anything like this unless I'm sure and convinced that it's backed up by the health advice, and it's for that reason that it has been. I understand that 2 out of the 3 major stadiums have already put forward their COVID safe plans, which have existed, and the 3rd one was submitted yesterday, which the health experts under the leadership of Dr. Chant will go through. So can I stress that whilst these major events, one-off events, will continue, I assume that outside of major annual events, the stadia won't be anywhere near that capacity. For ordinary matches or ordinary events, that capacity will not be achieved at all. However, for the one-off events that we hold once a year, so long as there's strict control, strict health advice, and the police have already been engaged to make sure they're policing those events, but the event organisers and the venues themselves will also have COVID marshals over and above that. As Dr. Chant mentioned yesterday, we'll be watching what the disease does in New South Wales during the school holidays, but the school holidays is also a time for us to consider through the health advice whether there is any opportunity to support families in different ways in Term 4, whether it's community sport or whether it's what schools can do in Term 4. So health will be working on that advice during the holidays depending on where we are with the pandemic at this stage. So